Yeah. I'll put my email in the chat, okay?
Perfect, thank you.
Hi, Abby.
Okay, it is noon, and I know everybody that's working in health is incredibly busy, so we will not wait around too much longer. I want to welcome you to the Change Management for Public Health webinar, sponsored by USOPHE and the Health Education and Promotion Master of Public Health degree at Utah State University. I'm Dr. Julie Gass, the Director of the HEP MPH at Utah State. So please reach out to me if you have any questions about our online MPH degree. I'll put my email in the chat. At the end of the webinar, Abby Summers from USOPHE will tell you how to obtain your CHES or CPH continuing education credits for attending the webinar, and more about the upcoming annual USOPHE conference. We ask that you keep yourselves muted during the presentation parts of the webinar, but please add your thoughts and questions in the chat. We are recording this webinar and it will be posted on the USOPHE website soon. Please feel free to share this resource with others. Before I introduce our speakers, we have 4 short polls we want you to complete so we can get to know our attendees a little bit better. Here's the first one. So here's our results. 77% of us are working professionals, 15% are students, and 8% are incredibly busy, and they're both. Here's our second one. So how long have people been working in health education or public health? Some are quite new, 36%, 1 to 3 years, 8%, 4 to 6 years, and we have a wealth of experience that we hope that you'll share during this webinar. People that have worked over 7 years in public health, quite a few of us. Okay, we wanted to know how much your organization has changed in the past year. And as you can see, mostly quite a lot or an extreme amount, which is really what this webinar is about. How do we adapt to that changing environment? Okay, and then the last one. Okay, and we wanted to know if this change was proactively determined and internally managed. And for the most part, not much. and change was almost always caused by external factors, was a large part of that. Okay, well, thank you for letting us know a little bit about your experiences that we can kind of add to this webinar today. I'd like to introduce the speakers. First, we have Dr. Steve Hawks. And Dr. Hawks is a professor in the Department of Kinesiology and Health Science at Utah State University. His research and publications have explored interactions between culture, eating styles, body esteem, and the nutrition transition. Global engagement and global health pedagogy are current topics of interest. Within USU's MPH program, he teaches courses in health administration, health policy, maternal and child health, and global health. We also have the pleasure of having Isa Perry speak today. Isa has worked for 25 years as a public health professional and is a certified health education specialist. She has a bachelor's degree in community health from Utah State University. She's a true Aggie, go Aggies, and a master of public health from the University of Utah. For the past 23 years, she's been at the Davis County Health Department, serving in positions such as community health educator, communicable disease specialist, community outreach planner, public information officer, and currently health strategy manager. She also leads the county's health improvement collaborative, Davis for Health. Isa is a passionate advocate for the health and well-being of the people of Davis County, including her family, friends, and neighbors. So without further ado, we'll let Dr. Hawks take it away. I think
Steve,
you're on
can't
mute,
hear you.
Steve.
Okay, how's that? Can you hear me?
Yes, we can hear you.
Okay, all right, here we go. Sorry. I'm honored to be part of the presentation today, and especially to have Isa present as well, to see someone go from student many years ago to being a leader in the field today. And so for my part, I'm going to introduce the concept of change management, a little bit of background and theory, and then turn it back over to Isa to talk about real world examples. Every year, the World Health Organization sets, they publish a list of 10 health items to watch. In 2019, pre-COVID, the list of top 10 issues, one of them was the potential of a pandemic, prophetically, and another one was vaccine hesitancy. So those were on the radar, two of the top 10 issues that WHO is looking at. And even with that on the list and everybody having thought about pandemic potential for many years, we were still caught, not off guard, but we were caught in a situation where we were not adequately prepared to manage what has happened. And so in 2021, 2 years later, if you look at the WHO top 10 list, 4 of those items are, how do we build back better? How do we work together in a multilateral way more effectively? How do we make sure that response to things like pandemics are equitable, that we take care of the most vulnerable, and so forth? And so the whole agenda for WHO is now revolving around what has happened, even though it was recognized it was coming down the tracks, we're still now responding to that. So change management is a framework for hopefully anticipating better where we need to be and getting there more quickly. 2 different models that I want to just briefly touch upon. The first one comes from Lewin, and Lewin was active in the first half, primarily of the 20th century. His model is fairly basic and straightforward, and yet very helpful conceptually. So phase 1, unfreeze based on a compelling message. And a compelling message that we need to change, we need to do things differently, we need to be better prepared. And coming up with that message that gets everyone on board. And then in step 2, change. The organization begins to transition to the new way of doing things while fully empowering employees and leaders to have an active role in that change. And then we refreeze as new practices are introduced, reinforced, positive feedback, encouragement, recognition, rewards, so that the changes are internalized by staff, they become institutionalized, and we're now where we want to be. Lewin passed away in February of 1947. And 2 weeks after he passed away, John Kotter was born. So an interesting pass of the baton. John Kotter's still with us in his 70s now, very respected leader in management, and came up with a different model. He published this in his book, The Heart of Change, 8 steps, establish a sense of urgency for change.
Steve, can I stop you for a second? Did you want to share slides?
Yeah, I've been sharing them. Are they not showing
No.
up? Oh. Apparently, Julie, you have to press the share button before it actually will share. So, sorry. Okay, is it up now?
It's still in process. There you go. It's ready.
Okay. Sorry about that. So this is Kurt Lewin, just talked about his model, unfreeze, change, refreeze. And so now we've got John Kotter, establish a sense of urgency, create the guiding coalition, get the key players involved and the right people at the table that can guide what needs to happen, establish a vision and a strategy, enlist a volunteer army, empower or enable broad-based action, create short-term wins, sustain acceleration, anchor the new approach in the culture. And so there's, the models on the surface appear somewhat different, and the Lewin model is maybe more conceptual, the Kotter model more hands-on. But when you compare them side by side, and you line them up against what actually needs to happen, what are the challenges, then there's a lot of overlap. I think that the Lewin model is, for me, interesting in kind of creating the broad picture of what needs to happen. The Kotter model is interesting in thinking through some very specific steps, but there's a lot of overlap. So the challenges are strategize, come up with the new vision and understand why we need to change and what the direction is that we're going in. That's the unfreeze stage, or the establish urgency, create the guiding coalition. And then we've got to have motivation and engagement for change. And as we noted in the poll, sometimes that change is external and thrust upon us. But even then, motivation, engagement, and where does the change need to go? Where do we need to end up at? Empowerment, motivation, creating ownership, establishing the vision, enlisting the volunteer, and then enacting the change through active engagement, empowerment, and then refreezing or sustaining the changes, institutionalizing the changes. So a lot of overlap between the concepts. And if you do a quick search on the web, you'll see all kinds of models pop up that cover the same kind of ground, maybe using different terminology, different graphics, obviously, but nevertheless, the same kind of process. And so that's the real quick and dirty background behind change management. And the takeaway for me is that the first step, it really requires a systems thinking approach. The first step has to be a step backward, see the big picture, look at the long range vision, see where we need to go, build the consensus, empower the team, move forward. And that's the concept. So I will turn it back to Julie and Isa to walk us through some real world examples.
Thank you. Go ahead, Isa.
Okay, sorry about that. Can you guys see my slides? Okay, it's good to be with you. This is kind of a full circle moment for me. 27 years ago, I sat in Dr. Hawks's health and wellness class and had a light bulb moment that this was going to be my career. So it's kind of crazy to have this opportunity today. But Julie and Dr. Hawks asked me to give a case study about change management in public health. And whoops, as I was thinking about this, I thought of it in two different ways, that how are organizations prepared to manage change and how are individuals prepared to manage change. And I wondered if we ever think about when we go to hire somebody, how is this person going to handle the changes that come? Or when we're looking to work for an agency or we are leading an agency, you know, what are we doing so that we're prepared to manage change? So just something to think about, a couple of concepts there. This is a case study or a scenario for you to think about. There's a local public health agency, and some of their key statistics in 2019, they had 130 employees, over 47,000 phone calls, over 2,600 disease reports, and over 16,000 vaccines were administered. And so skip a year and look at 2021, and these numbers were from about a week ago. This agency fluctuates between 300 and 400 employees. It changes every day. They've received 275,000 plus calls. In one day, we received 14,000 calls and 22,000 disease reports, and over 238,000 vaccines have been administered. So it's 3 times the employees, 6 times the phone calls, 10 times the disease reports, and 14 times the number of vaccines administered, with those numbers changing all the time. So I want you to think about an agency in that situation. And we're actually going to start off with some small breakout group discussions so you guys can talk about how you think these change management principles may apply to this scenario. So the discussion questions are, what are your ideas about how change management principles were used by a public health agency experiencing change with this scope and scale? What kind of organizational leadership would be needed in this scenario? How do you think health educators were utilized by this organization to adapt to these significant changes? And what expertise, skills, and characteristics do you believe made health educators valuable in this rapidly changing organization? So hopefully you guys can take some time to talk through those questions. There is going to be an assignment. So in the chat, we're going to have each of your groups share one thing you think this organization did to be successful in managing change of this magnitude, and one thing you think employees of this agency did to help the organization manage the change. So we'll make sure these are on the screen as you guys are in your small groups so that you'll remember the questions and the assignment. So I'll turn it over.
We're going to give you 10 minutes in a breakout room. We're going to assign you to a breakout room, and we'd like you to think about those questions and then answer those. And then somebody in your group, when we all come together, put your answer in the chat. And we're going to see, so we can all see everybody's kind of big take-home message after that discussion. So we're going to go ahead and put you in breakout rooms for 10 minutes.
Okay, so you're gonna go into these breakout rooms. You'll get 10 minutes. You'll get a 1-minute countdown to come back. And it'll just take me a minute to share the questions to the breakout rooms. So just be patient. 1 second. Julie, can you still hear me?
Okay. Laura, I wonder if we could take this off.
Yes, I can.
Thanks.
There we go.
Okay, so just as a reminder, if somebody in your group could go into the chat.
There's 20
And-
seconds, Julie, and they're gonna come back.
Oh, I'm sorry. I thought we were
You
all
jumped
back.
ahead. No, not yet. They'll get kicked back in 10 seconds and everybody will be in here.
Thanks, Laura. Okay, welcome back. And just as a reminder, if somebody in your group could put your major discussion points for those 2 questions in the chat, and we'll quickly review those before we go back to Isa's fantastic presentation. So this is a great comment. Being proactive is key, and being reactive, well better than, oh, moved out of my way here. No reaction is not preferred method. The concept of triage or prioritization to better allocate labor resources would help an organization be a lot more successful. Excellent point. Employees were able to be redistributed from their primary to fulfill new roles specific to pandemic and our changes due to the pandemic. Certainly, I said that happened a lot, didn't it? Where people were doing things they never thought they would ever have to do.
That's right.
One group said we felt that it would require adaptability and a willingness to think outside the box. Yeah, no, none of this is not part of my job description attitude, right? We have to adapt. Establish a strategic vision, which help organize all new employees into the right roles and how to make that happen within given timelines. And I like that idea also, Isa, where not everybody had the same skill set. So you had to think quickly who could manage a vaccination clinic, who could do what. Not everybody had those same skills.
Yes.
And then for employees, communicating often is spelling rumors were key to being successful, as well as being honest in their communications. Also, willingness to be flexible and take on new tasks. Those are great. Okay, and again, one more, communication between PHA, employees, and community members is crucial when disseminating information. We certainly learned that this year, didn't we? That communication was key, and health educators had to adapt to changes, assure the public, and build networks to provide resources. So that was all important. And somebody mentioned CHES responsibilities. And I think, Isa, you're going to talk about that as well. So
Yes.
why don't we take it back to you and your presentation. Thank you guys for participating in our breakout.
Okay, great comments. I can tell some of you were on the front lines as well. Can you see my slides all right? Is that a yes?
Yes,
Okay,
sorry.
great. All right, so I'm just one little person in our big agency of 400 employees. And so these were just sort of my thoughts and takeaways. You could probably ask other employees in our department and they might think of something different. But thinking about this, and sorry about that, it was really important for us to have a continuous or a culture of continuous improvement. So we are an accredited public health agency. And as you go through the accreditation process, which some of you are probably familiar with, it really stretches you. And you learn performance management, you learn quality improvement, you focus on community engagement, workforce development, you do things like branding, ethics, governance, you establish values. And every single one of these things was critical and helpful in being prepared for something like this. When you go through the accreditation process, you basically learn how to transform an organization. You do strategic planning, plan, do, study, act, cycle. So if you think about the strategic or the change management steps, they're very similar to these strategic planning steps. We also have responsibility for community transformation. So we use the Take Action cycle to improve our community. We have a community health improvement plan. We use a strategic prevention framework for prevention work. And so all of this is kind of in our DNA. We know how to work through these transformations because we've been doing it. Another key is public health emergency preparedness. Having emergency preparedness professionals is really important. And for our agency, we have the Public Health Ready designation. Well, that just shows that you plan, train, and exercise. So again, these steps feel very similar. And I think those types of activities and culture help agencies to be better able to manage change. And it's definitely something students should look for when they're looking for an employer. And so that's sort of how an agency can be prepared for change. We did mention leadership, and I just wanted to highlight this. Leaders are, by definition, change makers. When you are called to lead, you are called to advance, move forward, and improve the situation. And this quote in black really, to me, epitomizes what our health officer had to do. It says a leader takes people where they want to go. A great leader takes people where they don't necessarily want to go, but ought to be. Nobody wants to grow their staff exponentially in a couple weeks or a couple months. Nobody wants to learn 10 new things all at the same time. But luckily, our health officer did amazing policy work and worked with county leaders to get the resources that we needed, and then to lay out those steps so that even though we didn't want to go there, there was a path to go there and we had to get there quick. And so what did that look like and who was going to do it? And then with individual employees, and specifically for health educators seem to be very essential to this pandemic response. And as I thought about it and this change management theory and processes, it's because health educators have these areas of responsibility that they learn: assess, plan, implement, and evaluate. And truly, this is how we think. We do it naturally. We're constantly working through these processes, no matter what task we're doing, what program we're working for. And so that's what makes health educators so essential. Our director of health has said numerous times during this pandemic that health educators have come through clutch. They have been essential. They have filled many difficult roles. And he has been saying health educators are the future of public health. So there's a little pat on the back for all of you. In addition to these essential public health skills, there's universal skills that really serve every professional in the organization. Those who pick up technology faster are essential. We had one of our epidemiologists teach herself HTML and build our COVID dashboard just in weeks or less. And it was essential from the beginning to have that really amazing platform. Good communicators, staff who have good organization skills, management skills, teamwork. So much teamwork went into this response. Leadership skills and the quality improvement skills as well. I would just highlight maybe a couple of the roles of our health educators. We had health educators that served in nearly every facet of the pandemic response, maybe not as vaccinators unless they were a nurse, but truly everywhere else. We had health educators leading the design of our vaccine scheduling system, creating our incident command structure and getting everybody trained in their roles and responsibilities, doing disease investigation, doing active monitoring, leading our call center, communicating with mayors every single week, writing public health orders, and I'm trying to think, I know I missed it, social media, you name it, the health educators, and they moved around a lot. They were in high demand every phase of the response. was wanting our health education staff to lend them support. The one other thing that I noticed was important but super difficult is staff who have established self-care practices do better with change and do better with emergencies. And so that's really hard when you couldn't really make time for yourself. But I did want to share a quick example, and this is something that will hopefully help you, in any setting that you're in, any stage of life. But just wanted you to think, and then we can discuss some of these things if you'd like to, but think through this self-care recipe. I had been to a presentation a couple of years ago where the presenter had us write down. And so if you have a paper in front of you or your phone in front of you, write down your self-care recipe. And with COVID, this was just so front and center, because you either had people who were isolated, lonely, or bored, and I couldn't relate to that at all, or people with heavy load, constant teamwork, no free time, overstimulated, and burnout. And so it didn't matter which end of those spectrums you were on, you needed self-care. And so this self-care recipe, one way to think about it is consider the physical, social, spiritual, mental, and emotional activities that help you take care of yourself, that help fill you and refuel you so that you can do this important work. And one way to think about it that's really helped me is, what are your daily practices for self-care? Is that spiritual practices, physical activity, creativity, some type of connection? And then what do you do every day? What do you do once a week? What do you do once a month? What do you do every year? And really define in writing, I would say, what your personal practices are for self-care, so that you can be ready for this overwhelming task that sometimes comes and lasts for a very long time. So those are just the highlights that I wanted to kind of reflect with you on with this case study, but I'd be happy to take any questions or have any other kind of discussion that you guys would like.
Thank you, Isa. Can I start off the questions, and please just jump in. There's, if you can go off, you can mute and ask questions, but you highlighted the skills that people needed. Did you, like, from the university perspective, we're always thinking like, what are we not teaching that we should be teaching? Is there a message for the universities on things that we should be teaching in this, that we've learned from COVID, that we're maybe not preparing students very well?
Well, it's been a long time since I've been a student, but I would say I hope that in curriculums now that a wide variety of technologies are used, so that is a variety of spreadsheets, design software, video meet software, web design, like just a lot of technology skills is very beneficial. I think, I'm not sure what the community engagement piece looks like of what you guys are training students and future professionals, but just really understanding how to represent community voice, community culture, and concerns, so that you can try to present messages that actually resonate with your community and don't alienate your community. So I don't know, those are a couple of things that I was thinking of. I mean, in addition to just kind of what it looks like to be a good leader, what are some of the characters, traits of a good leader? I think every health educator has the potential to be a public health leader.
Right, thank you. Angela asked a question. She says, your health department educated arguably the best vaccine system. What made your agency different to be more effective than other counties?
So this is really the inside scoop. Our community health division director, Ivy Melton Sells, I'm sure some of you know her. She has a strong history in emergency preparedness, and she really helped get us organized in our incident command structure in the beginning. And then she was told, you need to go sequester yourself away with a few key staff and work with our information systems programmers at the county and develop a vaccine scheduling system. She had no, training in program development, but she was protected from the demands of everyday COVID on purpose so that she could dedicate time and effort to working with these other county experts to develop our scheduling system. And honestly, the day that we opened to the public, the system wasn't available to the public yet. And there were many, many tweaks over time because there was no way to truly predict the scale and the speed at which things would change with the vaccine rollout. But somehow, amazingly, that system was able to adapt and keep up. And we were able to train many, many people how to use the scheduling system. So we always answered every call and were able to get people scheduled for their vaccine. So that's probably just part of it, the story, but it was very, there was a lot of foresight in making that happen instead of, oh, the vaccines are available. Well, what scheduling system are we going to use? That would not have worked for us.
Great, thank you. Are there any more questions or comments for Isa or Steve? We hope that this webinar on change management helps people kind of think about handling these crises in the future, because certainly this won't be the last. Oh, Mary had a question. Let's see. Have you evaluated your procedures so you'll be better able to handle another pandemic? Great question.
Yeah, this is one of those things, you know, where we are evaluation minded. So continuously looking at that. And we did find that we had some weaknesses. We didn't regularly communicate with our mayors and we didn't regularly communicate with legislators, but very close to the beginning of the pandemic, we established those communication channels and every single one of them has our director's cell number and texts them on a regular basis. So what was a weakness became a strength. And we found that with just every little clinic process, we just constantly fine-tuned and tweaked so that, you know, we were able to have a very efficient mass vaccination clinic. CDC said it was a model to follow. And I believe it's just because we continuously tweaked it, like every day, the process from traffic to how the professionals helped people through, and just knowing that we really needed to serve our most vulnerable and our seniors. So always thinking of the needs of our most vulnerable, and if you make it accessible to them, it helps make it accessible to all of the public. I'm trying to think of other specific evaluation examples, and they're not coming to me, but definitely that's what's everyday briefings were about. What do we need to tweak today? And we did that continuously.
So Isa, oh, Dr. Hawks, Gabe has a question for Dr. Hawks. Dr. Hawks, has the COVID pandemic uncovered any public health issues that traditionally haven't been a focus for the WHO?
Thank you, Gabriel. Good to hear from you. Has the COVID pandemic uncovered any public health issues that traditionally haven't been a focus for the World Health Organization? And I guess my answer is probably not necessarily, but I think the focus, the things that have come into greater focus because of COVID-19 have been the inequity and the vulnerability of populations, the differential impact that the pandemic has had on different countries, different populations, and different groups within countries, and how ineffective we have been globally and at most national levels in catching that quickly and dealing with it effectively. And so WHO is much more honed in on or focused in on the issues of inequity, and obviously with vaccination rollouts and where the vaccine's going and who has access to them has been a big issue and an ongoing issue. And so, yeah, I guess the vulnerable populations, the inequity, even though that's always been on WHO's radar screen, we've laser focused on it now because of COVID. And I've got a question for Isa, since I've got the floor for the moment. In the change models that we looked at, the final stage is institutionalizing the positive aspects of change. So what is your health department going to be doing going forward that's now institutionalized or now has become a routine part of everyday life that may not have happened without this major transformation?
The one example that comes to mind, and I'm sure there's many others, is just hiring. How do you hire quickly? And do we have job descriptions to help us to bring on the right type of professionals quickly? And we didn't have job descriptions for all the roles that we needed to fill, but now we do. And so just that in and of itself, bringing new staff on and making sure they're the right fit, and having the flexibility to hire non-public health professionals in certain roles when needed, especially when the public health workforce is maxed out, I think is something that we'll be able to use moving forward to help with surge in whatever the case may be.
Sorry, as I'm monopolizing, but I have another question, and maybe other people can chime in. I was meeting with an MPH student the other day, and she was a little disheartened about the hostility that public health professionals experienced, and kind of questioning whether this is the right career path. Ironically, I also read in The Nation, APHA's newspaper, that public health interest in public health degrees is skyrocketing, so that's good. But what advice do you give? There's some students on this call. Is this a good career choice? Is this, knowing what you all know now, is this what we should be doing?
If you love it, you love it. You take the bad because you care about your community and you want to help your community. And it's true. Public health isn't really super popular in Utah just because of competing values with, independence and freedom and all of that. And so public health isn't always looked upon favorably, whether there's a pandemic or not. But I do feel like we have seen some real public health heroes and some people in our state who have been able to inspire us and inspire our community and to be seen as scientists and respected. And so I think it is a great field. I think we're going to be busy forevermore. Like, I don't think public health is going to slow down. And if you like, helping out your community and having a direct impact on the lives of those people you love, it is a great field to have meaningful work every day, even if it's overwhelming at times.
We have a couple more questions, Isa. Do you have suggestions if you're the only health educator in your organization?
That's super hard. I can't actually imagine that scenario. But I think the key is training up prevention professionals around you. So just teaching prevention science in layman's terms as much as you can, and making sure that the people that you work with understand strategic planning, and that the processes that your agency uses and your coworkers, that they can see we're assessing, planning, implementing, evaluate, and that we never deviate. We do that with everything that we do. So I think those are processes that can be taught to any type of professional and with any type of team you're working with.
And Angela had a great question. Isa, how does your agency make sure to continue to support other crisis areas such as opioid epidemic while dedicating staff time to the pandemic?
Well, that has been the saddest and hardest part. I used to work a lot on our other health improvement priorities, which are suicide, opioids, ACEs, and trauma. And we literally had to pause on all of those things for the most part. And we're trying to get our feet under us and reach back out to our partners and see. Obviously, other agencies continue doing the work that they're good at. And we know that things didn't just come to a standstill for every other agency, even though it did feel like that for us at times. So in our case, we're looking to see, what had our community partners been working on over the last year and a half, and where do they need us? Like, what is our role and has it changed since the pandemic started? Before, we were a convener and we were monitoring progress and we were advocating and measuring and doing all of those things. And so we're hoping to get back to that, but that's been a casualty, I would say, or at least it was paused, that important work, but luckily not everybody paused on their important work.
Great, thank you. And I want to thank Isa and Steve for presenting, and USOPHE for letting us do this webinar. And I'd like to have Abby Summers from USOPHE talk to you a little bit more about your continuing education credits and the conference.
Absolutely. Okay, so I am going to share some links in the chat, as well as I'll quickly share my screen with you, just so I can explain everything. If it will let me. Sorry. There we go. Okay. Can you see my screen?
No, it was doing it, Abby. Try again.
Started and then stopped.
Yeah.
Sorry. Okay.
Okay, we see it now.
Okay, perfect. So the first thing that I wanted to talk about was USOPHE, we have our annual conference coming up. You can register now. And some of these great folks that we've had on here with us today will be presenting a special track on addressing COVID-19. So I encourage you to register. You can register now by the 29th. And the registration link is in the chat. And let's see if it will let me. Sorry, it doesn't want to let me advance here. Okay. We also have USOPHE board and awards nominations are open right now. So I put those links in the chat. There's also these QR codes if that's helpful for you, but we're really looking to fill these positions. USOPHE is a great opportunity for any stage of being a health professional. So we'd love to get those filled, and you can always reach out if you have more questions on that. And then we are offering, thanks to the kindness of the MPH program at USU, free CHES credits and CPH credits for this webinar. So I've once again, I put those links in the chat. You can also use these QR codes. You do need to fill out the sign-in sheet and the evaluation. Even if you're watching this on the recorded version and you didn't attend live, you still need to fill out that sign-in sheet. So I will leave this up for you, and it's also in the chat. And thank you so much for joining us. We were so happy to put this on.
Great, thanks again, everybody, and have a wonderful week. Abby, did you see the comment in the chat about the CHES credits?
Sign-in sheet is showing everyone's data. Okay. I'll have to check into that. I'm glad that Mary brought that up. It's not working. Okay.
You might have put the link to edit the form, not share the actual
Okay.
form.
I wonder if that's the one that they sent me. Okay. Let me unshare and I will see if we can get the right one up there. I apologize about that. When I tested it, it seemed to work fine.
Of course.
So
And
that's how it goes.
You're going to send an email to all the
Yes,
participants for
we'll
you.
email it out as well. Yep.
Okay.
wonder if Lindsay can hear. I wonder if that's the Lindsay that went to USU a long time ago. I can't see people's faces. Okay, sounds good.
I will put in what I think hopefully this time should be the correct, that will be the sign-in sheet. But yes, we will also email these out, so shouldn't be a problem since we're down to 11 folks.
Yeah. Thanks, Abby. Just
You.
go ahead and invoice us for the